I was a pastor. But, but I have come back as a colleague, a brother to you. And on behalf of Kenya Counselling Psychologists Association, Nakuru County, I want to thank you for the honor to come and share with you on matters Counsellors and Psychologists Association. I have two things I'm going to talk about. It's about the Counsellors and Psychologists Board, which has been mandated by the government. The bill was passed by the president and ascended. So we have the board in place that is running the affairs of the counsellors and psychologists, and it has begun the registration. Registration is on, not licensing. You need to understand the difference. Then I also speak about the KCPA. But before then, allow me to speak something about you as a counselor. And there are two things that are happening to the counselors within our league. Because one is the self-care of a counselor. How do you take care of yourself? From the time you graduated up to now, how have you been taking care of yourself as a counselor? Because without taking care of yourself as a counselor, it will be a challenge to serve others. And I know our trainers are in our midst. I happen to train at KTTI, and second Tuesdays at MBCI Radio, I have a program there on family and marriage. And every time when we are sharing with our clients, the number is overwhelming. You as a counselor, how are you taking care of yourself? So there are two things, self-care and self-awareness. You will never serve your clients better if you are not aware of yourself. I have served in a hospital, to be specific, Mathare Hospital, a branch of Mathare, Nairobi at Gilgil. And when I was there, I realized many of our clients in psychiatric unit, they come and our nurses could act on them. And sometimes their frustrations at home could just come out on the clients, on the patients in Ward 6. And sometimes you will see the way these people are suffering. Others wangedungwa tu. By then we were calling it a stopper. Anaingia anadungwa. And then when they come to your desk, you assess the client and you feel like this patient was not supposed to be injected. He was supposed to go counseling and maybe given some tablets and go back home. But because of lack of self-awareness and self-care, you act and react to your clients. I want to know how many of us are practicing counselors. You are practicing. You are practicing. And Madam Anna, I want you to see the hands. Please, nimesema Madam Anna inua mingi. Now, how are you taking care of yourself as a counselor? What is your self-care program? What self-care program have you put in place to yourself as a counselor? Number two, are you aware of who you are? When we talk of self-awareness, this is understanding what you can do and what is not within your periphery. For instance, there are cases that will come to you and you feel this one should be handled by Counsellor Molel. Are you kind enough to refer? Because some counselors have got to a point, they feel like when you are referring, you are incompetent. Allow me to tell you the truth today. Referral is a sign of professionalism. And it is a sign of a strong practitioner or professional. So referring doesn't mean you are weak. Doesn't mean that you are incompetent. There are just cases you need to refer for your good and for the good of the client. This is not a career. This is another calling of a profession which you have to work with your client in the process until they get to know the strength and the potentials in themselves. So are you self-aware that in your life there are things, as much as you have gone through the program as a diploma, as a degree, as a master's student, there is a level, there are things you cannot deal with. You need somebody else. That is part of self-awareness. Know how much you can do. Some of us cannot do family therapies. True or false? Do we refer them? But do we get these courses? If we get these cases, do we refer them? And whom do we refer to? Madam Anne has mentioned, and allow me to quote her again, that we have the best institution, the best, yes, but whom do we refer to? This has caused many counselors to be wounded healers. You are sick, you're trying to deal with somebody else. And we use a lot of negative energy. Allow me to speak to you because I'm the secretary at the county and encounter a lot of things that sometimes I look at it and I say, this one I think needs supervision. Every time you have dealt with a client, find time to also go through with somebody who is superior to you. If you have a diploma, look for someone who is a degree holder. If you have a degree, look for someone who has masters. If you have masters, look at somebody who have a PhD, and they will take you through the process because that is what we call supervision. And don't feel so painful when you pay these people, because the language the world is getting that we do pro bono services is because we ourselves, we cannot afford to pay for the services we are given by our colleague counselors. If I cannot support you as a counselor, then how can a client support my service? I bet with you, some of you have injected a lot of money to get to where you are. True or false? You have injected a lot of money. Some of you didn't get any scholarship or sponsorship. Actually, it came from your pocket. Is it worth it for you to be paid for the service you are offering, or it's not worthy? And let's begin from there as counselors. As much as you're serving, you are supposed to earn from it. Now, the only way to earn from your profession is by being a professional and doing the right things right. Do the right things right. You can be doing the right things, but in a wrong way. So we need to value ourselves. So find a time for self-care. How? Number one, find a break. Schedule your regular breaks. Our campus coordinator has told us he's going to break and be with his family. That is part of self-care. He needs just to sit down with his children and his wife, and even kama kuna ng'ombe hapo ama mbuzi, hata yeye sasa ajue vile zinakulanga. Now, do we break from our daily routine as counselors and just find time to relax? Number two, take care of your physical health. Find time for your health. Go to the gym if you can. Take a walk. Please nurture relationships. I have found out that counselors are one of the poorest people to nurture relationships. Our relationships are poor. And if you can quote me wrong, kindly write down the network of friends you have. And then ask among those friends who are counselors in your cycle. How many are counselors? And forgive me. I'm talking to you because I'm part of you. So look at the friends you have. Mention 5. Out of 5, how many are counselors? A food for thought, isn't it? And then learn to say no. Don't be all of everything. Remember that story we were being told in our childhood of those animals? And one animal used to say, I'm all of you. I think it was a tortoise. Do you remember that animal? And when they went for a celebration in heaven, somewhere in the sky, and when the fruits were brought, these fruits are for all of you. So no one could take any fruit. They are meant for all of you. When lunch was being served, the whole meal, the whole course for all of you. All birds could look at this, all animals could look at this guy, and he could eat everything. But the time came for them to fly back to where they came from after the celebration. And the story ends by saying he could not fly. And that is why we have the tortoise with cracked scale. Learn to say no. There is a point in your profession you say, thank you, but I cannot do this. It's not within my proximity. It's not within my jurisdiction. I say no. Sometimes we die running, looking for finances. But to whom are you looking for finances for? Whom are you looking for? Those finances. To give who? The much you can eat is one plate. So the rest, who is taking care of them? So how is your self-care? How is your self-awareness? Are you aware of who you are? Through supervision, you can find time to also emote your issues. Just bring it out, open up, speak about it, and the healing process goes through that process of supervision. Find someone, open up to, speak to, and then also seek for someone to mentor you. Who is mentoring you in your profession? Because our counseling profession is an ongoing process that every time new things are emerging, and we need to add value to ourselves. Are you adding value to yourself? The approach of 1943 is not the approach of 2023 in counseling. So are you adding value on yourself? And how? Do you have somebody to mentor you? And please, for those seniors who are in our midst, I'm one of you. We should not use our young people, our juniors, for our own benefit. Because something that is pushing away many professionals in counseling psychology is taking for granted our juniors who are joining the profession by using them to enrich ourselves. I know you cannot look at me at the eye, but that is the truth. When we are earning a lot, we need to consider them. The only way we can learn that what we went through was not good is by being good to someone who is coming on the line of our service. So if you was mistreated at your early practicing of a counselor, don't try to misuse someone who comes along to join the profession. You will be paying back. And two wrongs cannot make a right. So let's encourage them. For those who are upcoming, let's groom them, let's embrace them, let's be there for them. Kenya Counselling Psychology began 1990s, and yesterday I was in a meeting where one of us was talking to Dr. Kidongo, who is a member of the National Board for the Counsellors and Psychologists Association that was appointed by the President, and something has just come up. That even through registration, there is something has to be done. In this nation, you remember the unions, the NAT, Kenya National Union of Teachers. Counselors have a union, and that is KCPA. For a long time from 90s, KCPA have been doing the responsibility of the government. One, for licensing and registering counselors, and the entry point is a diploma. So the government have been thinking, and we have been pushing for this, that we have counselors and psychologists be recognized by the government. And our prayers was heard. In 2017, when we did the first move, they came and gave us a draft, but last year, 2022, they passed it, and in this year, 2023, the board was formulated. Now, after the board has been formulated, KCPA still remains as a registration, a recognized organization that brings together all counselors and psychologists, right from a diploma to the PhD level. In the process, when you come to KCPA, if you are not registered, we have moved from paperwork, we are now digital. What you need to do is you just to go to KCPA, you just type, if you have a phone, you can try it, type KCPA portal or Kenya Counselors and Psychologists Association. The web page will open, and then you go to the portal. If you are a member, you key in your membership. The password is your second name, your surname. Then when you tap it, then it will lead you. If you have not registered, down there is a place it has asked for new registration or membership. You just get in. And we will be sharing with you on 3rd November, we have the Nakuru County all counselors and psychologists meeting
We are planning it. For those who are on KCPA wall, you have seen my postings because I post those updates. So we are planning for a meeting to address these things in deep and in length. And we want to have a consultation with all counselors in the county because we want to draft something and present it to the board, both to the board, CPB board, and then KCPA leadership, so that we have a place. I want you to know that Nakuru is one of the counties that has the largest, actually we are more than over 600 counselors in the county. In every sub-county in Nakuru County, we have 11 sub-counties. And we have in every sub-county a representative of KCPA. So you can imagine how, if we get together and we grow together, how we can push even the county government to recognize us and give us a place. Like the mental health that was there the other day, was it on 19th? No, 9th or 11th, something like that. When we were supposed to go there, but you found midriff, I think some of us were there, midriff and PDO were running the show. The counselor, when our chairman stood, he was just given a few minutes. Yet, we are dealing with matter that relates to mental health. So we can have a stake in our county government, just as we are going in the government. So KCPA is there for each one of us. So long as you have a diploma, that is the entry point. In our county, we always pay 2,000 registration at the county for the members to run the office. And then at the national level, depending at the level of entry you are, you can go in from diploma, I think is 2,500 ordinary members, and then it grows until you get to the PhD. Registration is ongoing, and we want to invite you to work with us. And I want to make an appeal to each one of us. May I see how many of us are registered counselors with KCPA? You are registered. So if you have not registered, join this team. And before I leave here, give me your contact. I request through my brother Molel. We give your contact. I will add you on case. How many are on KCPA wall? KCPA wall. The county wall for all counselors. Kwa wale hamko, we officially invite you so that you engage with others. Let me surprise you. When you engage with other minds, you realize there are more opportunities. I want to thank God for Agatha. Agatha has mentored a lot of young people in her office where she's working. And you cannot get to that level if you don't engage with other minds. So KCPA is there for us. We want to invite you. And on 3rd November, we are organizing. We are paying, because our office don't have cash. For logistical purposes, we are just paying 400 per member who will attend, and then join us. We will be posting those updates on our wall, and then we will walk through, because it's very important for each one of us. I want to speak again on the same, and I will take maybe 1 or 2 questions if you have, if I'm allowed by my big brother. Another thing is that in our counseling profession, there are many quarks. I'm a pastor. I'm a pastor by calling. I'm ordained by Kenya Assemblies of God. But I want to let you know this. There are pastors who are harming our clients. Yesterday, Madam Ann, will you allow me, coordinator, will you allow me to give this? Yesterday, I was somewhere in the office where I'm serving, KTTI, and a young man is brought, umbatted, and the mother is saying it's demon-possessed. I was just sharing this with Mary. And he goes to a pastor's office. Good enough, this pastor is my student in a counseling class. So the pastor assesses the client and says, "Apana, huyu mpelekee Reverend Charles." The client comes, I assess the client. The client is undergoing drug-induced psychosis. This client has been on marijuana. For 3 months, he was lost from home. Alishikwa, amekaa cell 1 week. Ameachiliwa, amekuwa akitembea on mountains in the name of seeking to know God. But were it not for somebody to intervene, alikuwa aenda afanyiwe deliverance. Wangapi umeenda deliverance hapa? I know you cannot raise your hand. You have raised. Were you delivered? No, I was. May God help you. You know, you can only be delivered. They do, these people, they do a lot. Others have taken their children for deliverance. I always tell people, before you take your child for deliverance, pass through a psychologist's office or a counselor's place. Let them assess, wakwambie hii ni demonic, ama hii ni mtoto ako kwa addiction, ama hata ingine ni mental illness. They are just under depression or early stages of anxiety. Take them through anxiety, Beck's anxiety assessment kit. Take them through. Let these people. And you know, this boy alikuwa apelekwe kukemewa mapepo that didn't exist. Non-existent demons. And others have named them. Ati pepo kaidi. Pepo sumbua. And they name it and they are very serious. And counselors are there. Amen. Remove it. And you are a counselor from SPLU, St. Paul's University. Na uko tu hapo zako tu za amen. Do it, pastor. So where is your counseling class? Where is your psychology? And when I assessed this boy, I sent him because I don't prescribe medication. So I sent him to Dr. Wafula, our consulting psychiatrist at the PGH. And guess what he writes back to me? Charles, thank you for sending this boy. He was in early stages of schizophrenia. Sasa angekemewa mapepo wiki ngapi kama hajaenda nuts? That is how the harvest is ripe. But we are not seizing the opportunity. Friends, I want to encourage you. Strategize yourself. Even in that church you go. Penye hawaamini counselors, wanaamini roho. Munaimba masaa matatu ndio roho ashuke. Please sing with your eyes open, identifying clients. Open your eyes, identify clients. I identify clients in the church and I send them for counseling because of dual relationship. I don't counsel them. I refer them. Na nawaambia msirudi hapa tena kama hamkuji na barua ya kwamba mmefanyiwa ushauri. I have lost a lot of members, but in the long run, I'm happy. I don't take it for granted for the knowledge I have. Join the team. We are the people who are movers of this generation. Live around this country. Seize your opportunities. Strategize. Stand strategically. Place yourself in a position that you are going to walk through this journey and you'll be recognized. Don't wait for somebody to lift you. Stand at the crossroad strategically. Let people see you. They'll begin recognizing you. KCPA is there to support you. If you have not joined, join us. And I can tell you, na kuna wale ambao tayari wamedevelop. Ask them, how did they get there? Maybe they went to where they are because they didn't join any group. Where we are going in this country, you will not practice without registration and being certified. Certification is going to be a mandatory to weed out all the quacks that have been having our profession. I want to encourage you, this is the first forum I'm speaking to after we have had that meeting on 22nd last month. We were holding a meeting with National Media Group in Nairobi on mental health, and the director of the board, and the spouse of the deputy president was our chief guest. And this is what came out. Professor Lukoya mentioned something that I want to tell each one of us. Where we are going, counseling and psychology is going to be mandatory in every institution. So brace yourself for better days. But have you aligned yourself with the requirements? Do the registration at the Counselors and Psychologists Board. It's on the website is there. I will share. It is still on our KCPA wall. For those who are not yet there, make sure you register yourself as we await for certification by next year. Then align yourself with KCPA. The advantage is this. When you are registered with Kenya Counselling and Psychologists Association, during the certification, because we are registering, during awarding of licensing and certification, you will not be subjected to the exams, because KCPA will be representing you that this is a practicing counselor, and we are aware ethically and professionally that he's part of us. That is the advantage. For those who will go directly to the Counselors and Psychologists Board after registration to be certified, they will be given an exam. They have to sit for an exam, and you know the government exam, the QT is here. I think you have tested one here at St. Paul's. We are telling our members, don't take it for granted. Seize the opportunity of this window period. Register as KCPA, because they will give you a portfolio. And then give the registration, because it's a bit high for the Counselors and Psychologists Board, because I think it's 5,000 for degree and master 6,000. We will give you the details. It's on the web. So you can send it the account to Cooperative Bank. They have details. We will be sending them to you, and they will support you. But if you want to go and take the national exam from the government, please don't join KCPA. Wait for your time. But if you want that window period, join KCPA, attain your KCPA number registration, so that when Professor Kashuda will be presenting the names of the members, and you who will have already registered themselves, you will be on the safe side. It will be just accreditation and licensing as a professional. May God bless you, and thank you for giving me your time. Maybe you have a question before my brother Moleli comes. Anyone with a question? So we invite you on 3rd. We have the Nakuru County, all counselors and psychologists. You can register with 400. If you are not on the wall, just give your name and your contact. I will add your name right away, and you can join us on that day. Let us interact and brainstorm and see the opportunities and see how we can help our society to be better off in matters of mental health. Thank you for having me, and God bless you.